So migraine headaches, what do you do for them? And you say you have great luck with migraine headaches.
Well, it's
or
not
chronic
luck.
headaches too.
You know that all these patients are going to have arthritis. The same way they have arthritis in the lower back, they have arthritis in their neck. And they have the shooting pain, burning headache going from the back to the front on top of your eyes. Sometimes it feels like there's like an arrow going through your forehead. Sometimes it's burning, sometimes it's shooting, sometimes it's pressure, but it's always pain. And it doesn't allow you to sleep well, to do what you love to do, being with your grandkids or your kids or whatever, because you always have this headache. I have hundreds, thousands of patients that I have seen for this condition. They've seen the neurologist, they've seen their primary cares, they continue to fail the migraine medication, and they come to me and they say, why didn't I see you earlier? And you know what I always tell them? I don't know, but here I am, and I'm
So
ready
then
to
what's it
treat you.
coming from? Okay, so they have a headache. How does it have to do with the neck?
Because there's a little nerve called the third occipital nerve that causes that pain shooting up. So let's say you're a gymnast, or let's say you like to ski a lot when you were younger. You probably fell, injured that joint, and as you got older, it has happened to hurt more and more. And now you're having these headaches all the time. So I see a lot of young women, young men, now with tech, everybody's texting, right? So they get tech neck, right?
Is that right? Okay.
And then you can fix that. Or the other thing I see a lot, car accidents. You're in a car accident, you get that whiplash injury, right? And I can find out which are the nerves that are bothering you. You're having that migraine headache after the car accident. We do the injection, it's gone.
Does it ever go away that second or that day?
It goes out. You'll see your results in 2 or 3 minutes.
How long does it take you to do?
About a minute.
Really?
Yeah.
And their migraines are gone. How long does that last?
Well, you know what? It's interesting. Sometimes it can last up to 6 months or a year without doing the ablation.
So you're basically, is it coming from the disc? Is something pinching on one of the nerves? Is that what's going on?
It's the joint that is getting affected. It's the arthritis that is affecting it. And sometimes you can say, well, I'm only 25. How come I have arthritis?
Yeah.
Well, you start getting arthritis as soon as you're 15, 16.
Okay.
Right? It's just that it doesn't hurt. But then you get older. Unfortunately, we can't fix that.
So you inject the area. It's kind of like numbing the area.
You numb up that nerve with a little bit of local anesthetic. You do it with the X-ray guidance because you have to know where to put it, right? And then you put it in there in the right spot. Headache's gone.
Really?
And
I know people with migraines.
All the time.
Because it's hard when you have children or a family or anything. I mean, you go to work.
Imagine if you would have a headache that is 10 out of 10 all the time.
Does that happen? You hear that?
All the time.
And it's gone. So that's kind of a miracle for some people.
For some people it is. I mean, imagine if you had it for 10 years. How would you feel? How would your family feel? I know your son, right? How would he feel if you're grouchy all the time? You don't want to talk to him. I have a headache. Right?
Yeah, they say she has a migraine. Stay away.
Stay away, right? You want to stay away from those people. And then you fix it and, you get very sociable. Well, why? Because I don't have the headache anymore. I'm enjoying life again, right? That is the key to our practice. Get you back to enjoying life.
And you're able to do that without medication. Can they get off their migraine meds? Because those
Absolutely.
migraine meds work.
They do work sometimes if you have a migraine, but if you have a headache from the back of the neck, they're not going to work. And they're expensive. Sometimes you can get jittery on the medication. It can affect you. You have to take it all the time. You have to get injections once a month, sometimes every 3 months. And then you do this, and you don't have to see me for a year. Imagine that. You don't have to go to the doctor for a whole year.
Why do migraines come and go? Is there a short answer to that? It's like certain times of the month or whatever.
Migraines are, they're very complicated sometimes. But these ones, the ones that I can take care of, you'll know in 3 minutes. My headache's gone.
So it either works or it doesn't work in the office?
In the office.
Did they say that's it? Did they say
yes?
It's that easy?
Yes.
Do they they're out of pain, but they're also going, how come nobody ever told me this?
That happens all the time.
What do they say? Like, how do they say it? Like,
they say they look at me and they say, is that it? My headache's gone. And I say, I know. Do you feel better? Yeah. And they say, what do I do? I say, whatever you want to.
And now they're back.
And now they're back to their regular
good attitude, more likely to hike, whatever.
Staying active, go swimming, whatever you want. And in New Mexico, Albuquerque, there's 330 days of sunshine in New Mexico. There's hundreds of things to do outside. You can go down to the bosque, hike near the river, you can go up to the hills, whatever you want. There's no limits. You can do whatever you want and enjoy your life.